Welcome to Health Literacy Basics. This module describes how health literacy affects the way that people access, understand, and act on the information you provide. The module offers strategies to help you and your organization become more health literacy friendly in order to better communicate with the people you serve. If you're completing the module individually, take time to jot down your responses to questions highlighted throughout the presentation. If you're completing the module as a group, pause the presentation and take time to discuss the questions, then continue the presentation to hear the response. So before we continue, what is health literacy? How would you define it? Take a few moments to respond. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Most people think health literacy just refers to how well a person reads, but is that what it means, or is there more to it? Can people with low health literacy find good information? Do they understand what it means? Can they take the actions recommended to have better health? Health literacy is more than just a reading level. Let's find out why.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That's
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, Okay.
But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that, something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So health literacy is more than just how well someone reads. It also includes listening skills, understanding numbers, writing, being able to find reliable information on the internet, and being able to analyze information in order to make decisions. So for just a moment, imagine you're taking your young child or grandchild to the doctor because he has a stomach ache and diarrhea. The doctor asks you lots of questions and then says your child probably has an enteric illness. He then hands you these instructions. Would you be able to follow these instructions? Why not? Well, these are actually instructions for how to wash your hands written in Somali. But for someone with low health literacy skills, the English text version may be just as difficult to read and understand. So what happens when a patient doesn't understand the doctor and isn't able to follow the instructions on the paper? Well, a lack of understanding might lead to poor compliance. They may continue not to do hand washing. It may also lead to the spread of the disease, maybe to others in the family or to colleagues at school or work or in a child care facility. The child may get sicker, may have poor health outcomes, may even have to go back to the doctor or be hospitalized, which will increase the healthcare cost. And the family may be less likely to seek medical care in the future if they were embarrassed or felt stupid or thought the doctor really didn't help them. These are all costs of low health literacy, and all of these impacts can be prevented with better communication that fits the patient's health literacy level. So here's the real cost of health literacy. 7 in 10 consumers fail to follow medication prescription instructions, which cost the pharmaceutical industry up to $20 billion a year, costs that are then passed on to consumers through the price of medicine. 18,000 older people die or are seriously injured by prescribed medication each year, and about half of these deaths are preventable. The annual healthcare costs for people with low health literacy skills are 4 times higher than for those with higher literacy skills. In fact, low health literacy increases U.S. healthcare costs by $50 to $73 billion a year. But you and your organization can make a difference. You can help to bring these unnecessary injuries, deaths, and costs down. Your organization sees clients with low health literacy every day. Who are they? Does this person have low health literacy? Does this one? How about this guy? Does she have low health literacy? You can't tell, can you? When a person walks in your door, you have no way to really know what their health literacy level is. Now, some people are more likely to have low health literacy. Older people or people who don't speak English as their first language, racial and ethnic minorities, as well as people with less than a high school degree, people with a low income, and people with compromised health status. But you really can't tell just by looking. So pre-screening for low health literacy is not recommended. Some people hide their low health literacy well. They pretend to understand, they nod and they smile, they try to fill out forms, or they might make excuses for why they can't fill the forms out. So here are some red flags that may indicate someone has low health literacy. They may frequently miss appointments. They may fail to follow through with lab tests or referrals. They might say they're taking their medication, but their health just doesn't seem to change. They might even say they forgot their glasses or that they'll read the paperwork when they get home, and some people may even ask you to read it for them. They might fill out forms, but they could be incomplete or inaccurate, and they may not be able to tell you what medicine they're taking or when they take it. So these are all behaviors that might indicate someone has low health literacy. But the fact is, you can't tell a person's health literacy level just by looking at them. In fact, 9 out of 10 people don't have the literacy skills needed to manage the demands of the U.S. healthcare system. Limited health literacy means a person has difficulty accessing, understanding, and acting on health information. It's not just based on their reading level, their education level, or even their income level. It crosses all socioeconomic levels. And at certain times, literacy skills can drop even lower, such as when a person is worried or uncomfortable. Maybe they're feeling vulnerable, like when you go in for your annual PAP or your mammogram, or for a cancer screening, or when your small child or your elderly parent is sick. So since we can't look at a person and determine if they have low health literacy, we want to use the same health literacy principles and practices with everyone. We call this health literacy universal precautions. Now, screening patients individually for their health literacy level is not recommended. Everyone needs plain language about their health. Everyone deserves universal health literacy precautions. What does that mean? What are health literacy universal precautions? Healthcare professionals use universal precautions, that is, wearing gloves or a face mask with all their patients, regardless of what the chief complaint is. In the same way, we use consistent health literacy precautions with all people, regardless of what we think their health literacy level might be. Health literacy universal precautions means you provide understandable, accessible, and actionable information to all people, regardless of their perceived health literacy level. For example, instead of giving someone the text version of the hand washing instructions shown earlier in the presentation, you could use a picture-based version like this one. How might this handout help someone with low health literacy better understand how to wash their hands? So the first key to becoming more health literacy friendly is to use simple, picture-based written materials like the hand washing information page. But you can't just depend on written documents. You need to engage all adult learning styles. Some people learn by reading, others learn by listening, still others learn by watching or by trying it themselves. What is your learning style? Do you read the instruction manual cover to cover? Do you highlight, underline, and take notes? Do you prefer to listen to someone explain information? Would you rather watch someone demonstrate something to you? Or do you prefer to just dive in and start pushing buttons and pulling levers until you figure it out? You might even have 2 or more learning styles. Your clients will have different learning styles too. People receive information and learn in different ways. To engage all learning styles, you have to tell them with plain language. You have to show them using the chunk and check method and visual cues. And you have to demonstrate for them. And then you have to let them try it themselves. So to engage all learning styles, you have to tell them, show them, demonstrate it, and then let them try it. So the second key to becoming more health literacy friendly is to engage all adult learning styles. When you communicate with clients, you need to be sure your communication is as clear as it can be in order for it to have the best chance of being understood. If you tell a client to come back tomorrow for a makeup appointment, what will she expect? Will she bring her foundation and eyeliner? If you tell a client in your waiting room that your staff member is running behind schedule and will call him back later, what will he hear you say? Will he sit in the waiting room, waiting to be called to the back, or will he go home and wait to be called back on his phone at a later time? Now, these misunderstandings may sound silly, but remember, communication that is not clear can lead to mistakes, lack of compliance, and poor health outcomes. So the third key to becoming more health literacy friendly is to improve your communication. Let's talk about 3 main strategies to improve your communication: plain language, chunk and check, and visual cues. Clear communication begins with plain language. That means not using jargon. See if you can restate these sentences in simpler language without jargon. You've suffered a contusion to the soft tissue below the 4th thoracic vertebra, exacerbating the proximal sternum. Limiting your sodium intake will reduce your risk of hypertension and cardiovascular disease. Give it a try. Well, what is this person really trying to say? You've suffered a contusion to the soft tissue below the 4th thoracic vertebra, exacerbating the proximal sternum. In plain language, you bruised your rib. Limiting your sodium intake will reduce your risk of hypertension and cardiovascular disease. In plain language, eat less salt to have a healthier heart. Plain language also means keeping it simple. Speak slowly and clearly and use words that have less than 3 syllables. Instead of saying cardiovascular, say heart. What could you say instead of hypertension? How about contusion? Fill in the rest of the answers. Plain language also means using action words that are interactive and answer the question, what should I do? Convert these passive statements into action-oriented recommendations. For example, instead of saying, lifestyle modifications are essential, what should I do? Choose a healthier life. Now you try it with the other 2 statements. So plain language means using no jargon, keeping it simple, and using action words. Another clear communication strategy is using the chunk and check method. The chunk and check method breaks down complex information into digestible chunks. It prepares a person for learning, helps them focus on key points, and then checks for understanding. When you're providing a person with new information, choose only 3 key points. What are the 3 most important things you want them to walk away remembering? Then start by preparing the client for learning. If you're going to be talking about recommended daily servings of fruits and vegetables, you could say something like, today we are going to talk about 3 ways you can eat more fruits and vegetables every day. Place the handout in front of the person and highlight 3 subheadings around the 3 key points you've chosen as you list them. Then go back and provide education on the first point. Before you move to the second point, check for understanding by asking an open-ended question. For example, so what would be one way you could add a fresh fruit at breakfast? Then repeat their words and review the first point. For example, you have a great idea there. Adding a banana to your breakfast smoothie would be a great way to make sure you're eating more fresh fruits and vegetables each day. Now move on to your second point. Again, check for understanding, repeat their words, and review points 1 and 2 before providing education on point 3. Check for understanding again, repeat their words, and summarize all 3 points. Summarizing the 3 key points at the end of your session helps to cement them in the person's mind. Be sure to use open-ended questions to check for understanding. You could say something like, how would you explain to your best friend what we've talked about today? Also, be sure to encourage the client to be interactive by taking an action. This solidifies the learning. So you could say something like, today we talked about 3 main ideas to increase the amount of fresh fruits and vegetables you eat every day. When you get home, how are you going to use this information? So to chunk and check, highlight on a written document 3 key points you will discuss. Break down complicated information into manageable chunks for a person with low health literacy, and check for understanding after each point and again at the end of your session by using open-ended questions. A third communication strategy is using visual cues or visual aids. Remember, some people need to see a demonstration to learn best, and others need to touch an object or manipulate it to learn. So when you talk about how your dinner plate should be made up of 1/2 vegetables, 1/4 protein, and 1/4 starch, have the person draw out the portion segments on a paper plate. Use common items to provide a visual for what a 3-ounce serving of meat looks like, or what a 1 cup of vegetable serving might look like. Some people may even need to hold the item, so their brain associates 1 serving of vegetables with the 1 cup sized baseball they're holding in their hand. So we've talked about 3 key concepts to becoming more health literacy friendly: using written materials that are picture-based and easy to understand, engaging all adult learning styles, and improving your communication with plain language, the chunk and check method, and visual cues. Let's discuss one more strategy to help you and your organization become more health literacy friendly. The 4th strategy to become more health literacy friendly is demonstrate, observe, and verify understanding using the teach-back method. If you want your patient to monitor his blood pressure at home, you will need to show him how to take his own blood pressure, let him try it while you observe, offering corrections as needed, and then verify his level of understanding by asking him to teach it back to you. You might say something like, we've talked about a lot of information today and I want to be sure that I was clear in my explanation. Would you tell me what you heard me say so that I can be sure I did a good job communicating? His response will help you gauge how well he heard and understood the information you provided. Let's watch the teach-back method demonstrated between a healthcare professional and a patient.
All right, Chris, so you came in today for an urgent care visit because you were feeling more short of air. And after examining you and looking at everything, we feel like the shortness of air is probably because your heart failure is a little bit worse. Today is Monday. Our plan is to help with the shortness of air, to help with your heart failure. I want you to double one of your medications.
Oh, go ahead.
So you told me that you've been taking Lasix 20 milligrams every day. I want you to start taking 40 milligrams a day. So you're going to take 2 tablets every day, and then you're going to take that every day for the rest of this week. And I want you to come back on Friday and see me again. The reason that I'm doubling the Lasix is because the Lasix helps pull the fluid out of your body. I think the fluid is what's making you feel short of air, and the Lasix will make you pee more frequently. And I think that will help with the shortness of air. Now you are pretty short of air. Your weight is up a lot, and so you are sick. I am concerned that if things get worse, you might need to get admitted to the hospital. So if you start having chest pain, worsening shortness of air, or if your weight goes up, I want you to either give us a call or come to the emergency room because I want to know that that's going on. Okay? So I just threw a whole bunch of information at you. Can you explain back to me what the plan is and what we're going to do this week for your shortness of air?
So, because I've been having more trouble breathing, you think it's because of my heart, and so we're going to double one of the medications I'm already taking.
Yep.
And if it makes me start to need to go to the bathroom more, I'm supposed to go to the emergency room and then call you guys.
So actually, we expect the medication to make you pee more. So that's how it works. That's how it gets the fluid out of your body. So we want it to make you pee more. But if you start feeling worse, if you get shortness of air or chest pain, those would be reasons to go to the emergency room. Okay. And I want to make sure that I did a good. I don't know if I mentioned what the name of the medicine was. So do you know which of your pills it is that you should be taking 2 of?
So I'm supposed to be doubling, taking 2 of my Lasix.
Exactly, perfect.
And it's probably gonna make me need to go to the bathroom more. And then if I start to have like chest pains or like it hurts here, or if I'm the breathing, my shortness of breath gets worse, then I'm supposed to go to the emergency room.
Exactly.
And then I'm supposed to come see you on Friday.
Right.
Okay.
And we'll check up and see how everything's doing. Okay. What other questions do you have?
I think that's it. Are you guys gonna give me like this information?
Yeah, I'll give you some patient education about heart failure and things to look for, and put it with your deep heart information. Okay. All right.
Okay.
All right. Well, it's good seeing you today. I'll see you
Thank you.
again. All right. Thanks.
What did the healthcare provider do well? What could she have done better? How did using the teach-back method improve communication and understanding? How do you think using the teach-back method will affect the patient's likelihood of taking his medication correctly? The teach-back method is not just for use by doctors and nurses. It should be used by all staff in your organization. Remember, universal health literacy precautions should be used with everyone who walks in your door. Watch an example of the teach-back method being used by a receptionist as she schedules a client appointment.
Good afternoon, Community Healthcare Network, CAPS Health Center. This is Gina speaking. How may I help you?
Hi, I want to get a physical.
Sure, I can help you with that. Have you been to our center before?
I was there with a friend, but I didn't see a doctor.
Okay, what's your first and last name?
Maria Diaz?
Thank you, Miss Diaz. Is that spelled D-I-A-Z?
Yes, it is.
Okay, I just have to ask you a few questions to help you set up your first appointment. What is your date of birth?
It's October 11th, 1989.
And your address?
999 Blake Avenue, apartment 4A in Brooklyn.
Okay, great. And your zip code?
11208.
Thanks, Miss Diaz. Now, could you tell me your telephone number?
Sure, it's 718-555-4567.
And do you have insurance?
I do. I have Metro Plus. Do you guys take that one?
Yes, we do. All right, thanks for all of that information. The next appointment we have is with Dr. Summers on Tuesday the 13th at 10 a.m. The next appointment after that is on the 16th at 9:45 a.m. or 2:15 p.m.
Is that this month?
Yes.
Okay, I think the Tuesday would work better for me.
Okay, we can book that visit for you. Just a few things before you come in. Please call your insurance company and let them know that Rebecca Summers is now your PCP. And when you come in, bring all your necessary documentation, including insurance card, photo ID, and any prescriptions or medications you take. Please also bring your health records.
Great, I can do that.
Okay, so you're all set, Miss Diaz. We'll call you in a couple of days for your appointment.
Okay, thanks. Bye.
Thanks for all that information. So I'm looking at our schedule, and the next appointment we have is next week with Dr. Rebecca Summers on Tuesday, August 13th at 10 a.m. Then the next appointment after that is on Friday, August 16th at 9:45 a.m. or 2:15 p.m.
I think the Tuesday works better for me.
Okay. Do you want me to schedule you for the 13th at 10 a.m.?
Yes, please.
Okay. And I'll schedule you for that appointment. Now, before you come in to see us, we ask that you call Metro Plus and let them know that you're going to start seeing Dr. Rebecca Summers and that she's going to be your primary care provider, or PCP.
Great, I can do that.
When you come in, please bring your Metro Plus card, photo ID, and any medicines that you take. Please also bring any papers that you have about your health, like past test results or x-rays.
Okay, great.
So, Ms. Diaz, you're all set. Before you hang up, though, I want to make sure I was clear in explaining what to do before your appointment and what you are to bring. What do you plan to bring to your appointment?
My health records and my ID and my insurance card.
Right. And also your medicines.
Great, yeah, I can bring those.
And when you call Metro Plus before you come in, you'll tell them?
That I am going to see Dr. What's her name again? I can write it down.
Dr. Rebecca Summers.
Great, and I'm going to tell them that she's my new primary care provider.
Okay, great. So you're all set for Tuesday, August 13th at 10 a.m. with Dr. Rebecca Summers. We'll give you a call 2 days before your visit to remind you.
Great. Do you have the number for Metro Plus?
I'm not sure what their number is, but if you look on the back of your card, there'll be a number there.
Okay, great.
Is there anything else I can help you with?
No, I think that's it.
Okay, then we'll see you on Tuesday, August 13th at 10 a.m. at Cabs Health Center. Have a good day.
Great, thanks. Bye.
What did the receptionist do well? What could she have done better? How did using the teach-back method improve communication and understanding? How do you think using the teach-back method will affect the client's likelihood of keeping her appointment? So remember, use universal health literacy precautions with every person because you can't tell what their health literacy level is at any given moment. Tell them, show them, demonstrate, let them try. This engages all adult learning styles. Use plain language. Leave out the jargon, choose action words, and keep it simple. Use the chunk and check method to break down complex information into 3 key points and check for understanding. Then use the teach-back method to make sure your client understood the information you provided and knows how to act on it. Studies show patients will forget half of what their doctor says before they leave the exam room, and half of what they do remember will be remembered incorrectly. This means they will walk away from an appointment remembering only 1/4 of what their doctor told them. Your clients are no different. Make it easier, not harder. Why is it so important to use universal health literacy precautions? Listen to the plea in this video. This is bad enough. Don't make it harder than it has to be.
This is bad enough. This is bad enough, so please don't give me gobbledygook. Don't give me pages and dense pages and this leaflet aims to explain. Don't give me really dodgy photocopying and do not remove for reference only. Don't give me drafted in collaboration with the multidisciplinary stakeholder partnership consultation short life project working group. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in. A little time to show them at home. A little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start. The contacts there at the end. Give us the info you know we need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough, so please, speak like a human. Make it better, not worse.
You can make it better. Communicate clearly. Give every person the fair opportunity to access, understand, and act on information, regardless of their health literacy level. It's bad and tough and hard enough. Speak like a human. Make it better, not worse.